Hi, this is Sarah and Jolynn. We are currently in our first year of the School and Counseling Psychology Masters of Education program at the U of S. And we are approaching our research project from a more psychology background. We both have interests in adolescent mental health and a kind of a wide variety of counseling. So we combined our efforts. So the purpose of this study is to delve into more teen experiences and perspectives on drug use. Um, Young adults and adolescents have the highest rates of self-reported illicit substance use in Canada. There's lots of things changing in Canada right now with legalization of marijuana. Non-medical use of prescription opioids is on the rise, so we feel this is an area that is extremely important to research. And any information that you gain from studying adolescent drug use can be used for prevention programs in schools or social programs and interventions and treatments. Another thing to keep in mind is that motivations to start using a drug are very different than the motivations to develop into a risky substance use trajectory. So that is something we also wanted to explore in this project. The purpose of the study is to really tap into the lived experiences of individuals during adolescence in relation to drug use, while not solely focusing in on addiction and substance use disorder. There is probably a very large population of individuals who frequently use drugs at risky levels during their young youth years, but then for whatever reason choose to stop and grow up to be healthy adults. So I think this is an underutilized population, and their voice has not been heard in research very much. So this is the reason why we're approaching this project with a qualitative, story-driven methodology. Substance use and adolescence has a very extensive amount of literature written about it, and lots of research conducted on it. The the majority of research, however, really focuses on measurable factors and instances of use and abuse. There are many different risk-taking behaviors that are studied, pathways to drug use, individual factors such as psychopathology or trauma. Role of the family and parental practices is another large area of research. And then, of course, social relationships, peers, friendship networks, and just the social acceptability and availability of drugs. So a major limitation of the research that we identified is that while there's lots of research on substance use, it's usually from a reactive level. It's looking at when problems arise, what are the risks, as opposed to more the views and perspective of adolescents in general on drug use. And another major factor is that most studies on substance use include tobacco and alcohol in them. In our research proposal, we're excluding alcohol and tobacco just because the levels of use are so much higher, and the motivations for using substances other than alcohol and tobacco are a lot different. So we wanted to explore strictly youth drugs.
So next up is methodology. We decided on a qualitative methodology, namely the interpretive phenomenological analysis, which is also IPA. So basically this was chosen to address the gap in research. Most of the research was based on quantitative studies, therefore we thought it best to get up close and personal to the actual lived experience and understand the phenomenon behind the question, what motivation pathways lead to drug use and what major influences move individuals away from dangerous patterns of use. So ultimately we seek to gain insight into adolescent substance abuse patterns and what protected them from addiction. So most of us have had experiences with drug and alcohol abuse, and though we have had our own experience and interpretation, the point of the study is to distance ourselves somewhat and to allow the phenomenon of the data to surface. So what is happening with these youth? What was their experience? Keeping a reflexology journal will be important for us as we interview these young adults. So we as researchers are trying to understand the process of why some adolescents were able to be protected from harmful addiction. This will be done through inductive reasoning, where we will develop our theory from the ground up and be open to the phenomenon of resilience in these youth. So as we begin our research, we will be open to our questions actually changing. That's the beauty of doing an inductive approach. You're able to change things as you find understanding into the phenomenon. So we're wanting to understand the phenomenon these young people experience. What was the phenomenon that protected them from addiction? Connected to the phenomenon is the meaning that the interviewees will bring to their experience. So this will help guide our research analysis. So our design will be emergent, as we will only be able to analyze data based on what our findings are and what emerges from our research. We understand that we may not be able to understand all the reasons behind why some of the youth do not fall into addiction or are protected from addiction. However, through our research, we hope to find key patterns and concepts that will help in future education, prevention, and understandings of addiction. So basically, in a phenomenological study, one is looking for structure in a phenomenon, and therefore the number of participants will vary. So typically in this approach, smaller numbers are used, and in this study we decided to interview at least 8 subjects for 1 hour each. And we chose purposeful sampling to target participants between the ages of 20 and 26 age group who have been abused of drugs in their teenage years who have not fallen into addiction. So we'll recruit these subjects through a poster at the University of Saskatchewan. We'll make initial connection, make sure that they're screened with our inclusion criteria. The data for the study will be spoken accounts with the use of conversation interviews and personal narrative. And for each session, we'll use audio recording the interview for transcribing and analysis and ensure it's locked in a safe location to protect their confidentiality and privacy. One of the most important things about phenomenological research is that we have a good relationships with our participants. So we need to be able to be good communicators. We'll be asking semi-structured and open-ended questions, and we're coming to this research with curiosity so the data can speak for itself. So we've chosen an ideographic method, which basically means that we're going to identify patterns of behavior, thought, and emotion with an individual, rather than strictly identifying patterns of differences between the individuals, if that makes sense. So we're going to be looking over the data as a whole initially to see what services, then we'll go phrase by phrase using thematic clustering, and eventually coming up with a schematic form. So what we want to do is look beyond the surface to deeper patterns of what is presented to us rather than based on our assumptions. And yeah, so that's kind of a little bit about how we'll do our methodology and data analysis. So some ethical considerations.
Drug use in our project. To do a proposal on youth drug use.
That we have. Basically, because this will incorporate human resource, we need to make sure that we have informed consent. We'll create an agreement between us, and we'll ensure that their confidentiality and privacy is the utmost importance for all of us. So some of the limitations of design is basically, unfortunately, this won't be a study that's in real time. So it will be a subjective nature. So the participants will be remembering from their past. Now, that's okay because this is a phenomenological study and we want to understand their experience, but it would be nice to have some sort of ongoing research where someone could do research where it's over a longer period of time with the same students. However, you wouldn't know whether or not they'd become addicted or not, but that would be an interesting study. So those are some of the limitations. Anyway, that's our research. If you guys have any questions, we would love to hear from you. We'll have a couple questions down below if you'd like to comment.